Hello, hello. I'm Breton, one of our MCAT tutors here at Inspira Advantage, where we help students get accepted into med school and other professional programs. In our previous two videos on the cardiovascular system, we focused on gross anatomy and Starling forces. Now we're going to focus on a topic near and dear to both my and the MCAT's hearts, the heart. There are two big topics you'll want to understand for the MCAT when it comes to heart anatomy. One, what are the various chambers and valves called? Number two, how and where does the electricity conduct through the heart and cause a heartbeat? Let's start by understanding what the various chambers and valves are called. We will start at the right atrium, where blood is deoxygenated. This unoxygenated blood will move through the tricuspid valve into the right ventricle. It's called the tricuspid valve because there are three thin flaps of tissue called cusps. Now, as you can see by the picture, the ventricles are much larger than the atriums. This is because not much squeezing force is necessary to get the blood to move down from the atrium into the ventricles. However, a lot of force is needed to move blood from the ventricles to the rest of the body. Once our blood is in the right ventricle, it will be pumped into the lungs through the pulmonary valve. After the blood is oxygenated, it will return to the left atrium through the pulmonary vein. From here, the oxygenated blood will move through the mitral valve, also known as the bicuspid valve, two cusps, into the left ventricle. This is where the heart will do its final and biggest squeeze to force blood up and out into the rest of the body through the aortic valve. But what is causing the heart to beat? The answer is a series of neurons that are inside the heart conducting electricity to stimulate heart contractions. The signal begins at the sinoatrial node, aka the SA node. The SA node is very important to know and is known as the pacemaker of the heart, and it is located up in the right atrium, which makes sense as this is what will contract first. The nerves from the SA node then travel in a few ways across the heart. An offshoot will happen across the top of the heart to the left, called Bachmann's bundle, and another series of offshoots will move throughout the right atrium, called the internodal tracts. The internodal tracts will converge at the base of the right atrium at our next big important node, the atrioventricular node, or AV node. After the AV node, electricity will flow down the center of the heart through the bundle of His, all the way until it reaches the bottom of the heart, where Purkinje fibers continue the signals along the outside of the heart, functioning to squeeze from the bottom up. This squeeze will force the blood into either the pulmonary valve in the right ventricle or through the aortic valve near the left ventricle to then get out into the rest of the lungs or body, respectively. If we follow the general pattern of conductance here, we see that the heartbeat first squeezes the right and left atriums, then the signal travels down to the bottom of the heart where it begins contracting and forces the blood up into the pulmonary and aortic valves. Now you should know your essential heart anatomy that the MCAT expects you to know, as well as a glimpse into how structure precludes function at the organ level. Thank you so much for watching our video on heart anatomy, and I will see you next time.